Hey everybody, today I want to talk about calcium heart scans and coronary CT angiogram heart scans. I want to explain the difference and why it's important to understand this difference. So nobody wants to take a medication the rest of their life. And when you're checking ApoB, which is the carrier for cholesterol that is tagged on every kind of cholesterol that can cause plaques in your arteries, the way we lower that is with a statin or a PCSK9 inhibitor or some other medication for lowering cholesterol. And the reason we do that is because we know higher levels of these ApoB carrying cholesterols, they cause plaques in your heart. And it's just like smoking causes cancer. Not everybody who smokes gets cancer. Not everybody with high cholesterol has a heart attack. But it's important to understand what we can do to better understand if you should take these medications. So let's say you check your ApoB and it's elevated and your doctor says, let's start you on a statin. And you think to yourself, I'm not sure that I want to start on a statin that I'll be taking the rest of my life. And so what can you do? Well, what you can do is you can take a look inside your arteries in your heart to see what's going on. And that's where we come to calcium scanning versus CT angiograms. So I want to show you a picture of what a calcium scan looks like compared to a CT angiogram and help you understand a little bit the difference in fidelity of understanding what's going on in your heart. But first, I want to start off by explaining calcium scan. A calcium scan is a CT scan of your heart. So you lay down in the CT scanner, it's a big donut. They put you through it, takes just a few minutes, and it's done without contrast, no IV, and then it looks for calcium in your heart. And the reason is calcium shows up as bright white on a CT scan that doesn't have any contrast in it. And so you can see, is there calcium? And what does calcium tell you? Calcium tells you you have a plaque that has been plastered over with calcium, meaning your body has sealed it off and tried to make it more stable. Now, that's all it tells you. You have a plaque with calcium on top of it. It doesn't tell you if you have soft plaques that are elsewhere in your heart. And the reason that's important is it's the soft plaques that actually rupture and cause heart attacks. So a soft plaque ruptures, you have platelets and clotting factors that go to the site, they form a clot, it blocks up your artery, you have a heart attack, okay? So the hard plaques tell you that there's probably other plaques in the neighborhood. So that's what a CT calcium scan tells you. Let's look at a picture so I can explain this a little more. Okay, here we are looking at coronary calcium test scores. And I just want you to look, this is kind of what the heart looks like on a CT scan. I told you bright white shows up and that is calcium. So you see that as we go from 0, where you don't see any bright white in the heart, to over here, you're seeing a little bit, that's 1 to 100. Over here, you're seeing more, that's 100 to 300. And then over here, you're seeing the most, that's 300 plus for the calcium test scores. And the way that we see imaging on a CAT scan is, as a physician, as a radiologist, you imagine yourself standing at the foot of the bed and then taking cross-sectional slices of a person. And actually, you'll hear CAT scans described as slice density. And so we're looking through the heart. It's taking slices. The smaller the slice, the bigger or the higher fidelity. So you can see things in a more fine-grained way. And so that's what you're looking for. And a calcium scan usually isn't very fine-grained, but if there is obvious calcium, you get these scores and it helps you understand risk. So now I want to talk to you about CT angiogram and why you would do that instead of a calcium scan, because a calcium scan is not very expensive. These are anywhere from $100 to $400, usually $100 these days. $100 to $150 is usually what you're going to pay. But I want to explain why you would maybe want to get a CT angiogram instead of a calcium score. So let me explain what a CT angiogram is, and then we'll look at a picture. All right, so a CT angiogram is, again, in a CT scan, you're laying there, you're gonna get through the donut, right? This time you have an IV in your arm. They usually check your creatinine, which is a blood test to make sure your kidneys are doing okay, because the dye can be a little bit hard on your kidneys. And they're going to put this IV in. They're going to shoot the dye in. It's going to actually make you feel like you wet your bed. Like, it's this really strange feeling. They shoot the dye in, and then they time that dye to be pumping through the arteries of the heart the same time the CT scan is coming over you. And the dye fills the arteries of the heart and outlines the inside of the arteries. So again, we couldn't even see the arteries last time. Well, you can kind of see them, but you can't see the inside of them. And you could only see them if there was calcium inside. But this time you can see the whole lining of the arteries. And so what you can start to see is are there narrowing of the arteries? Even if it's soft plaque, it'll show up. And you can do these advanced scans like the Clearly AI heart scan and see inflammation and other soft plaques in the heart. And so I want to show you a picture of one rendering of what that looks like, so you get an idea of the difference of fidelity between the calcium scan that we already looked at and now CT angiogram. So let's jump over to that, and then I'll close by explaining who I recommend gets a calcium scan versus who I recommend gets a CT angiogram. Okay? All right. So here you can see this is rendering from the CT scan. So CT scan does the picture taking, and then the computer puts this together for the radiologist to look at, and they can see the whole outline of the blood vessel. So you can see these divots, you can see all sorts of things. Then they can actually cut into this and see cross-sectional. And let me see if I can find a picture of that for you. All right, so in this, you can see that they're actually able to see some inflammation in the lining of the blood vessel because the blood vessel is lit up. And now let me show you a cross-sectional view. And the cool thing about these modern CT scans is they can do all this twisting and turning of the heart and look at it in all different directions. So let me show you another picture. Okay, so this is the last picture I'm showing you. So CT angiogram, this is what it looks like to start, right? And then what will happen is the computer will render it and make it easier for the radiologist to see things. So you see this 3D view of it, and then you see this cross-sectional view. So you can see that there's this huge narrowing on the inside of this blood vessel, and only this little area, this kind of Great Lakes looking area where blood is flowing. So this is the fidelity with which you can look at the coronary arteries with a CT angiogram. Now let me tell you my recommendations on who gets a calcium scan and on who gets a CT angiogram. All right, so calcium scan versus CT angiogram. If you can afford it, I think everybody should just do CT angiogram. That's just the honest to goodness truth. It's a better study. It lets you see inside the blood vessels. You can see soft plaques, hard plaques. You can see everything. So usually that's going to run anywhere from $700 up to, let's say, $1,500. And if you want to do the Clearly AI scan on top of that, it's usually another $750. So it's expensive. So say you do the $750 scan, you do a $750 Clearly CT interpretation, and then you're at $1,500 for this scan. Now, why would that be worth it? Well, it'd be worth it because it might keep you off medication, and it's going to give you a very clear picture of what's going on inside your blood vessels. Okay. So I generally recommend, if you can afford it, do a CT angiogram. If you can't afford it, then okay, do a calcium scan, because a calcium scan is going to tell you, and I really don't recommend a calcium scan before age 40, but after age 40, and looking at the MESA study, which is a multi-ethnic study, and the Dallas Heart study, there are these studies where they looked at calcium scores in age groups. And really, until you're 40, 45, a calcium scan most likely is going to be 0. And it's not going to tell you if you have a soft plaque. And so I generally don't recommend it, although it is reassuring. If you're younger than 40 and you have a positive calcium scan, we have an issue. And we need to be super aggressive on getting your cholesterol under control. And you probably have a family history of heart disease. And people have heart attacks in their 30s and their 40s. So if you decide you want to do a calcium scan at that point, that's totally fine. Just remember, you'll only see calcified plaques in there. So If you do it and you're over 65 and you have a 0 on your calcium score, well, holy smokes, I'm super reassured. It's not as good as a CT angiogram, but you spend $100 and I'm going to say, oh yeah, if you don't want to take a statin, even though your cholesterol is high, I'm pretty reassured that you don't have terrible heart disease going on in there. So there is a time and a place where you could choose to do a calcium score, and I think it would be totally reasonable. I usually think of it as this. If you're going to do a calcium score and it's not 0, then you should move on to a CT angiogram. So the calcium score really becomes yes, no. Is it 0 or not? If it's 0, then cool, let's wait, let's redo it next year and check it again. If it is not 0, if it's 1 up to 300 or plus, then we're going to move on to a CT angiogram and get a really close picture inside your blood vessels. And sometimes if you have a positive calcium scan, your insurance will pay for a CT angiogram. And what we're going to usually do is recommend you go see a cardiologist. They're going to help you get prior authorization and get that CT angiogram done. So I hope that is helpful as you try to understand what is a calcium score, what is a CT angiogram, which study should I do. If you can afford it, go to the CT angiogram. If you can't, a calcium score every year is a good alternative. I hope that's helpful. Take care.